Do you have a preference?
If you can share, that'd be great.
Absolutely. So let me just share my screen. Go.
Hi.
Oh, sorry. And
Perfect. Thank you so much, Sophia, for the introduction, and thank you, Omar, Sophia, and Sharon for organizing and hosting this event. I think this is really great. Allison and I are very excited to be here to provide you a brief overview of the vaccines that have been approved for COVID-19. Next slide, please.
sorry about that. I don't know why it's not. There we go.
There you go. No worries. So just a brief outline. So we're going to go over the vaccines that have been approved in Canada, the purpose of these vaccines, and also the mechanisms of how these vaccines work. Yes, so for approved vaccines, next slide. Yeah, so in Canada, so far there are 4 vaccines against COVID that have been approved. So the first 2 are mRNA vaccines. So these are the Pfizer vaccine and the Moderna vaccine. And then the last 2 listed here are the adenovirus-based vaccines. So this is the AstraZeneca vaccine and the Johnson & Johnson vaccine. Although the Johnson & Johnson vaccine has been approved in Canada, it hasn't been really widely distributed. And the AstraZeneca vaccine, although it was widely used earlier in the pandemic, currently in Quebec, it's only recommended for those who had their first dose that was AstraZeneca. They would recommend the second dose to also be AstraZeneca, or for individuals for whom the mRNA vaccine is not recommended. So generally right now, in terms of distribution, it's generally the Pfizer and the Moderna vaccines that are being distributed. Next slide, please. Yes. So in the media, you may have heard that the vaccines were developed really quickly and in a short time span. And if you look at this graph, that in fact is true. So if we look at other vaccines, generally it takes many years to develop a vaccine from beginning to end. And as you can see in the last bar here, the vaccine against COVID-19 was developed quite quickly and put into production within a year. Next slide, please. However, if we really look at it, it didn't happen out of the blue and all of a sudden. So, you know, COVID-19 is a coronavirus, but it's also important to know that there are other coronaviruses out there. Some of you may remember the SARS outbreak that happened in the early 2000s. So SARS is also a coronavirus. And there's also another virus called MERS that's also a coronavirus. So research around coronaviruses has been going on for many years, even before the COVID-19 pandemic. And also the technology, the mRNA vaccine technology and research has been going on for more than 10 years. So it's important to remember in this context that a lot of the research and the knowledge that's been used during this pandemic has been developing over many years. And in terms of financial resources, so it's important to remember that billions of dollars have allowed pharmaceutical companies to take financial risks. So generally when a vaccine is being developed with clinical trials, first you need to ensure that the vaccine is safe, and then they want to make sure that the vaccine is effective, and then they begin production of like millions and billions of vaccines. But because this is a public health emergency, a lot of governments gave money to pharmaceutical companies to really expedite or speed up that process. So while they were running the clinical trials to ensure safety and effectiveness, they already began production of the vaccine. So because there was a lot of financial resources involved, they were able to shorten that timeline for the vaccine development. Next slide, please.
Archon, could we ask you just to slow down a bit for the translator?
Yes, sorry. I will slow down.
Thank you. Thank you.
All right, so on to vaccine purposes. All right, so in terms of the goals of the vaccine, there are 2 main objectives of the vaccine. So the primary outcome of the vaccine is to really prevent disease. So this means to reduce the risk of having severe symptoms, to prevent hospitalizations and deaths, and also to protect the recipient. This means the person who receives the vaccine. So this is really the main outcome of getting the vaccine. A secondary outcome of getting the vaccine is to prevent infection. So this means that if the person is not infected with the vaccine, that means infected with the virus, sorry, it means that they're not contagious, that they can't pass on the virus to someone else. It also leads to herd immunity. So this means that if enough people are vaccinated against COVID-19, transmission of the virus slows down or essentially stops. I know in the news, there's been some talk about breakthrough infections. So it's important to remember that it is possible that if you get vaccinated, you may become infected with the virus. That is a possibility. However, even individuals who got vaccinated and in that rare instance also get infected by the virus, what we notice is that the need for hospitalization or the risk of death is extremely low. And so that's what and again, that's the primary outcome of the vaccine. So, people who got vaccinated might still get the virus and get infected, but they don't have severe disease and they don't end up in the hospital. And that's what we really want to prevent. Next slide, please. So when someone is vaccinated, the goal here is to create antibodies. So the antibodies here are the little red things that you see in the image. And what antibodies do is that they stop the virus from replicating. And so they really latch on to the virus and they kind of, signal to the immune system to, target this virus and to destroy this virus. So it helps your immune system really go after the COVID-19 virus. Next slide. So when you receive the vaccine, your body creates antibodies against COVID-19. That's very similar to how your body would create antibodies if you were to be infected. But of course, you don't have the risk of being hospitalized or the risk of dying as much with the vaccine, compared to the infection. And what's really interesting is that data is showing that the protection from getting the vaccine actually lasts longer than if you were to get immunity from actual infection. So that's another thing that's really important to keep in mind. And of course, as I mentioned before, if you get the vaccine, you are not at risk for complications from COVID-19 disease. Next slide.
Okay.
So yeah, this is Allison. Yeah. I'll pass it on to Allison.
Okay, so I'm going to discuss how the vaccines work. So before I begin, there's one major difference between the mRNA vaccines and the adenovirus vaccines. And this difference is in how the recipe for the spike proteins enter our cells. So I'll go through this in more detail. But for both vaccines, the recipe is used by the cells to create coronavirus spikes. And once the spikes are created, our bodies recognize them as foreign, and our immune system destroys them. Our immune system continues to remember what the spike proteins look like. So if we're later exposed to COVID-19, our immune system is ready to immediately begin destroying the virus. Next slide, sorry. Okay, so both the Moderna and Pfizer vaccines are mRNA vaccines. To create the vaccine, scientists use the spike protein gene, which is shown here in red on the picture on the top right. And that spike protein gene is used by the coronavirus to create spikes, which are used to enter the human cells. And those spikes are found surrounding the entire coronavirus. So what happens is the recipe for these spikes, which is placed on mRNA, which is then placed in a ball of fat. And this mRNA is not harmful to the vaccine recipient. It only codes for the spike protein, it can't cause disease, and it's perfectly safe. Next slide. When a person receives the vaccine, the mRNA enters the person's cells and tells the cells to create the coronavirus spikes. So after the spike proteins are created, the vaccine particles are destroyed by the body. So after a few days after you're vaccinated, there's no permanent trace from the vaccine at all in your body. So your body clears it pretty rapidly. So once your cells create those spikes, they're then displayed on the outside of your healthy cells. And this is so that the immune system can recognize them. So the immune system sees them and sees that they do not belong and that they're foreign. Next slide. So at this point, the immune system will create antibodies that recognize the spikes. So if you're later infected with COVID-19, the antibodies will recognize the spikes and kill the virus, which prevents disease. Next slide. So I think this will clarify everything. So this process of getting vaccinated is very, very similar to ordering an Amazon package containing a cookbook. So the box is very similar to the vaccine. So it's just the packaging. And the box contains a cookbook that contains a recipe for pizza. And this is similar to when a vaccine contains a recipe for the coronavirus spike protein. Your oven then creates the pizza from the recipe. And this is just like the way your cells translate the mRNA into the spike protein. So after you create the spike protein, the mRNA is disposed of by your cell. And that's kind of like throwing out the entire recipe book. But your body will remember that pizza even after it's consumed. And that's similar to the way the spike protein remains. And this memory of the pizza or the spike protein are the antibodies your body leaves behind. Okay, the next slide, please. So I'll discuss in brief the AstraZeneca and Johnson & Johnson vaccines, and they're both adenovirus vaccines. The process is very similar, but it's slightly different in the early stages. So to create the Johnson & Johnson and AstraZeneca vaccines, scientists again use the spike protein gene. But in this case, the DNA is placed into a modified adenovirus. So the only purpose of that adenovirus is to deliver the spike protein recipe on the DNA to your cells. So the adenovirus is just kind of like the package to deliver the recipe, and the DNA contains the recipe. Next slide, please. So when someone receives the vaccine, the DNA enters a person's cells. But because it's DNA, which has 2 strands, as opposed to mRNA, which has 1 strand, the body can't immediately read it. So what happens first is that DNA is transcribed into mRNA. And that's in the bottom bubble. It's in the gray circle on the photo on the right-hand side. So after that recipe is then turned into RNA, which your body can read, then the cells create the coronavirus spike proteins. And just like in the other vaccine, after the spike proteins are created, the vaccine particles are destroyed by the body. So the DNA that was containing the recipe is destroyed within a couple of days, and it can't replicate in your body. Your body just reads the recipe off of it and then destroys it. And then the rest of the process is exactly the same as that of the mRNA vaccines. So the immune system identifies the spikes and then creates antibodies. Next slide, please. So this process, again, is similar to ordering an Amazon package containing a cookbook. So again, the box is just like that vaccine. But in this case, the box contains a cookbook with a recipe, but it's in a language you don't understand. So before your cells know to create the spike protein, you have to translate that language into one you understand. So that's just like the way your cells translate the DNA into mRNA. And then again, your oven or your cells create the spike protein. And after your spike proteins are created, the recipe is again thrown out. So it's just like throwing out the cookbook. And then your body remembers those spike proteins in their antibodies. Next slide, please. So in summary, all of the approved vaccines contain a recipe for the coronavirus spike proteins. So after you get vaccinated, your immune system will build up antibodies against COVID-19. And it's these antibodies that will prevent disease if you become infected with COVID-19. So the photo on the right shows an actual coronavirus. And if you can see on the outsides, those are all the little spikes. So if you're vaccinated and you get infected with coronavirus, your body will immediately recognize those little spikes around the outside of the virus and start attacking it. Next slide, please. I'm going to pass it back to Arjun.
Thank you, Allison. So now I'll just review some common questions that generally some people have. Next slide, please. Sorry, next slide. Yes, thank you. So in terms of fertility and pregnancy, currently there is absolutely no evidence to suggest that receiving any of the approved vaccines, including Pfizer, Moderna, or AstraZeneca, there's no evidence that receiving the vaccine would decrease fertility in both men or in women. And individuals who are pregnant should get an mRNA COVID-19 vaccine. And this is because if the pregnant individual does get COVID-19, it could result in severe COVID-19. And in that case, they can be at risk for high-risk preterm birth and pregnancy loss. Next slide, please. And in terms of blood clots, so some of you may have heard there were rare blood clots that were observed following the AstraZeneca and Johnson & Johnson vaccines. And these were caused by an immune response against a platelet factor that caused the release of a clotting material. What's important to remember here is that the risk of these blood clots are extremely rare. One fact that I think that's important to remember is, especially now with the Delta variant, some of the modeling data shows is that within this coming winter season or in the next year, all of us, whether we are vaccinated or not vaccinated, we will encounter the virus at some point. So the risk of us coming into contact with the virus at some point is very, very likely in the next year because of how transmissible the Delta variant is. But the risk of getting a blood clot is extremely, extremely rare. So given that the risk of encountering the virus is extremely high, it's really important to be vaccinated against COVID-19, especially to ensure that you don't have any severe health outcomes or hospitalization. Next slide, please. And then the other question that some people might have is myocarditis, which some of you may have heard in the news. So this is the inflammation of the heart muscle. And this is, again, an extremely rare side effect that's been noted with the Moderna vaccine. So very rare, less than 1 person in 10,000. And generally, it's been noted in males under the age of 30. But the symptoms are very mild and usually self-resolve on their own. But because of this observation, Quebec does prefer to give the Pfizer vaccine for youth aged 12 to 17. Next slide. Oh, and then that's it. So thank you very much. And we're happy to take questions in English, or I can take a question in French if someone prefers French.
How are the questions being fielded? Can I just ask a question as if I want to?
Yeah, definitely. You could raise your hand, or you could just indicate who is speaking, please.
My name is Sean.
Hi, John. And then we have Sita, who also has a question. Thank you.
All right. I saw that you were essentially saying that 1 in 10,000 is considered rare or very rare. Yet I don't really. One of the things that I am not sure about is the the likelihood that somebody in the population would actually contract COVID, whether they're immunized or not. And if that is very rare, then explicitly putting yourself under a treatment that has a very rare occurrence is only increasing the risk of an occurrence.
Thank you for that question. Was that John?
Oh, Sean.
Sean, sorry, Sean.
Yes.
Thank you very much for the question, and yeah, it's a great observation. So as I mentioned in the presentation, with again, these are based off of modeling data. What the modeling data kind of shows is that with the Delta variant being more transmissible, it is very, very likely actually that most of us will come into contact with the coronavirus during this coming season. So that's whether we're vaccinated or not vaccinated, that at some point it's going to be very likely that you're going to come into contact with the virus. So if we're looking at numbers and risk and chance, the chance of coming into contact with the coronavirus is much higher than these rare side effects.
Yeah, I was going to add one thing. So that number includes the Moderna vaccine as well. So that because the Public Health Agency of Canada and the Quebec government have noticed that those side effects are more common with the Moderna vaccine, that's why they're recommending that those high risk groups get the Pfizer vaccine instead to just lessen the risk of it. Yeah, but overall, the government still recommends that even young males get vaccinated based on the risk to the individual and the risk to society versus that risk of that myocarditis, which everyone has recovered from and resumed normal activities pretty rapidly. So it's not like an ongoing chronic condition that people are developing that's going to impact them for the rest of their lives. It's like a side effect that shows up within a few days, usually a few days after the second dose, and then it tends to resolve.
Allison, can I ask what is the resolution period? Is it a week after? Is it?
I'm just gonna make sure I know this.
But in other words, what's that short time frame that could you be more specific about that short time?
Yeah, I think it's around a week or two. It's not more than a month.
Thank you.
You're welcome.
Isita, I believe you had a question.
Yes, I just wanted to know, a pregnant woman who takes a vaccine, will those antibodies be transferred to her baby?
That's a really great question. I will preface by saying my expertise is more in epidemiology. So definitely, if someone is pregnant on the call, or someone who's pregnant, definitely they should speak to their doctor and make sure that they're getting the right advice. However, based on what I've read, we don't know yet. What we do know with other vaccines, so these are measles vaccine or other vaccines, is that generally with the placenta, antibodies generally do transfer from the mother to the baby. But the evidence, I think, is they're still trying to figure out with the COVID-19 vaccine. But definitely if someone's pregnant, it's best to speak to your physician about that question, I think. But yeah, thank you.
Thank you.
So just before we move on, I'll just like to read a question that came up in the chat. So it says here, there are a number of vaccines now being administered, seasonal flu, shingles, and others. Are there precautions that should be considered if one chooses or has to receive several vaccinations within a short period?
Yeah, so it depends on the vaccine itself. So I know that right now, at least in the United States, they're letting people get the COVID-19 vaccine and the influenza vaccine on the same day. At the same time, you could get both. I'm not sure of the other vaccines because it depends how they work with your immune system. But we can send out resources about that.
Perfect, thank you. And we have Anne Ken, sorry if I mispronounce your name, and Dr. Kessner following that. You're on mute, Anne.
I wanted to ask either of you two. I have been vaccinated, like most of us, the 2 vaccinations. One was AstraZeneca and the other was Pfizer. And I know there's a big debate about that, but really my question is about how we can still be carriers and asymptomatic of any symptoms. So that puts me in a very vulnerable position all the time. I feel like we should be tested because I have no idea if I'm a carrier, and I have a grandchild, and I'm constantly saying, you know, they won't give me a test until I show symptoms. This is what they keep saying. And I'm saying, well, what if it's too late if I show symptoms? Can you, this is a dilemma. How can we be asymptomatic and carriers? And why don't I have symptoms if I'm coronavirus positive, if I am? Do you see what I mean?
Do you want to, I can take it. Yeah. So, so the vaccine is not perfect at preventing infection. So what happens is really the focus of the vaccine is to prevent, severe symptoms, so to prevent hospitalization. But as you mentioned, the flip side of that is that those of us who are vaccinated, if we get infected, then we're more likely to have no symptoms or very mild symptoms that we don't really notice. So one good thing is if you're vaccinated, you're a lot less likely to become infected at all. So that's one thing, which is great. So, and also there's some recent evidence coming out that if you are vaccinated and you get infected and you have one of these breakthrough infections, it seems like people tend to spread it to fewer people, if that makes sense. One thing I'll also add is what I'm hoping this will happen at some point, because there's some other countries and some workplaces in Canada where they're using rapid antigen tests. So I know there's a lot of places where you could do sort of your self-nasal swab and get results within 15 minutes. I'm hoping that they'll become more accessible and common in the coming months. And then, before you see your grandchild, you could just, swab your nose and then know if you're infectious with a decent amount of certainty.
Can I just add to that? Because I do visit an elder in a long-term care facility, and that's what I do get from them. But I've just heard recently that that's not reliable. You could get a false testing. So I'm constantly worrying whether I'm going to infect somebody I visit or my grandchild, unless they are vaccinated, and he's under 12, so he can't be vaccinated. And should he be vaccinated? You see, it can produce anxiety, and I am not anxious, but I want to respect the virus because we're constantly finding different things, and I don't want to pass it on, neither do I want to get it.
Yeah, no, I completely understand. Yeah, so the rapid antigen tests are not as accurate as the PCR tests that we get, but the rapid antigen tests are fairly good at telling you if you're infectious in that moment. So they're like pretty good. But I recognize your concern, and I have similar concerns when I'm seeing people who are at higher risk than I am.
Right. Thank you.
You're welcome. Thank you.
Do we have any other questions?
No.
We'll just ask everyone to please mute themselves if they're not speaking. Thank you.
Yeah, Dr. Kessner had a question or no?
No, it's been answered. Thank you.
Oh, okay, great. So Yeah, thank you so much, Allison and Arch. And I love the recipe book analogy. I think that's really helpful for us to understand the different viruses. That was the highlight of the talk for me. And I'll pass it on to Omar, who's going to continue with Michael Farkas.
I have one question to ask. If a person has an inflammatory bowel disease, is it safe to get the vaccine?
So far, what I've read, the answer is yes. But I would definitely talk to your gastroenterologist or someone's family physician if they have it. But so far, I just read a paper today on individuals with IBS who received the vaccine, and depending on if someone's taking immunosuppressants, the antibody levels might be a bit lower. But I saw there are no safety concerns mentioned. But I would definitely talk to a family doctor.
But I'm not talking about irritable bowel disease. I'm talking about inflammatory bowel disease.
Right, that's what I meant. Sorry. Yeah, okay. No, it's inflammatory bowel. Sorry.
Okay.
Yeah, sorry.
Perfect. Any other questions before we move on? Thank you. So our second segment of this event will be focused on community advocacy. And so we're very delighted to have our speaker, Michael Farkas, with us this evening. So Michael Farkas is the president of Youth in Motion, which is an inner city youth center in Little Burgundy. And he is the lead representative of Montreal's Black History Month celebrations. He is also an urban mediator at the Burgundy Urban Mediation Project, and he is very passionate about Black history and the Black community. He spends most of his time working with his community to come up with ideas and start projects to help make the world a better place. So this evening, the main focus of this discussion will be around the importance of constructive conversations around vaccination. So welcome, Michael. We're very happy to have you join us this evening. And so before we start, and I just remember that the translation is happening, so if I'm speaking too fast, just let me know. So in terms of what we wanted to cover this evening, Michael, and I see here you're on, oh, okay, perfect, you're good to go. So from your experience, so working in the community with youths and different different individuals within the community, what is one of the most important socioeconomic factors affecting how individuals are responding to the COVID-19 vaccine?
Thank you. Good evening, Omar. Good evening, everyone at part of this symposium. Thank you for having me back. So I've prepared a couple of answers to your questions, Omar. The general theme to start is confusion. You saw the lady, what she just, Mrs. Kearns, I think, Ann Kearns, she just asked was typical of someone, not knowing if they're still, taking their shots and living, not knowing if she can still give it to others, questioning right now if for 5 to 12, I can't wait to see how that's gonna all operate. Will be vaccinated, will the parents accept? So I think, if we can touch a bit on even that, because that's the next big, the big move our government wants to impose on the 5 to 12. So maybe we can hear the pros and the cons. But confusion would be my main answer right now. In terms of socioeconomic factors, it's pure loss. Quarantine, loss of work, loss of activities, loss of leisure, loss of stable habits for many. I said for youth, for Black youth, but for many, loss of trust between family members and key models, loss of appetite, loss of interest, loss of common values, division, infighting, suspicion, and the list goes on. So effectively, the socioeconomic
well-being of our communities are put vastly at risk. And I would say to the doctors, and I know there's a couple here tonight, and to the politicians, is like, regardless if you treat me as a, how could I say, conspirationist, I can throw it back at you, because to me it's very clear that it's very suspicious when you don't hear our government leaders, the doctors, acknowledging and recognizing that through this pandemic that we have to go through and we have to do the right thing, that all the other things have just taken second, third, fourth, fifth, and there's no response. There's no meeting like this symposium tonight to address many other crucial factors that have just making our society fall apart. And all around me, every day people talk about that, and I never see our political leaders, or even doctors say, listen, okay, COVID, but wait a minute. Between overdose, fatal overdose, between pure gratuitous violence, and all this booming of hatred, and so on and so forth, because we're not able to give the next generation coming up in the Black community per se, but all communities, the different exercises that we do all the time in our communities, in youth centers and so on. Everything's been COVID only, when everything else is moving, still moving, and we're losing people to all kinds of other things. So I question myself deeply, and I cannot take the conspirationist, because I'll throw it back to you. Who's really conspirationist when so many people are dying of many other ailments at a rapid pace? So I'm going to stop there. So a lot of losses through this whole pandemic, loss of friendship, loss of a lot of things, and it has an impact on the socioeconomic well-being of our communities. Thank you.
Thanks, Michael. Now, the second question I had for you was, do you think there is a direct correlation between belief systems and vaccine acceptance or refusal? I know in the last session you did mention quite a bit around that as well, and that there is a tendency within certain communities around that. So can you expand more on that?
In certain cases, belief systems have dealt with other forms of healing. So as in many countries, we know they use all kinds of forms. We'd be, just go on YouTube, you can see all kinds of ways of treatment that have been very effective over, way before the time of Jesus. So in that way, whether it's belief systems accompanied with medical treatment that are also maybe not recognized by the Western world, they've proven successful, because a lot of times even the things that we put in our medical system come from different plants that they know of in certain countries, and so on and so forth. That is also intertwined with the spiritual, with different belief systems that a lot of people, even in our countries and in Americas, and Black people per se, coming from all over the world, have belief system that is intertwined with the upkeep of their liberty and everything. So we know the belief system have been part of forms of healing. In some cases, vaccines have gone horribly wrong, as experience has shown us. I'm not going to go too deep into it, because I don't think the COVID-19 is any close to some of the experience like the Tuskegee, the McGill LSD experience, and so on. But these things stay. If a man like me that was born in 1959, we still talk about these experiences, so they stay dans l'imaginaire, in the imagination of people. And for Black people, we've been obviously we're skeptical of medical treatments in many cases, because of the failure and the lack of also representation of Blacks being used for, let's say, even the COVID. So sometimes there's underrepresentation of our people to really say that it's effective, whatever we're going to take, or there's been clear medical essayage. They've been, whether it's the Tuskegee experience, McGill, and so on. And so some people are skeptical, and because I'll let you go to the third question, and I'll just open it up. A lot of people, you'll hear that vaccine is experimental. and it scares a lot of people. So that's what I had to say on the belief system versus vaccine and at this point.
Yeah, that's an interesting point you brought up there, Michael. And so, in line with that, as you mentioned, our third question was around that. So, how could all of those events or just that reaction, how does it play a role in vaccination response within the community?
I'm going to throw out a question because I'm not a scientist, I'm not a doctor. A lot of people in our communities, they sound like doctors, and they're scared of being induced with lifelong changes to their body. So it is, a lot of people are vehiculating the part that this COVID has something to change slightly or your DNA. So if someone could clear up that matter, if it's true or not, because that's what we hear a lot sur le terrain, that it's actually going to change undoubtedly a bit of your DNA. And most of you, for the peoples that wouldn't know, I took my 2 shots and everything. So because I work in the public, and I've been junkied out since my birth. So I said, come on, let me take that before any one of my kids take it, because I have 6 kids. But it's just to say, so my question to any doctor, does it slightly or partially or even in a small percentage change our DNA? We hear a lot of fear. The other thing I would say that basically, especially hearing the comment of the lady that was asking with the confusion that is also presented to her and to most of us, it brings a lot of unhappiness on both sides. I took the vaccine. Am I really more happier than someone that didn't take the vaccine? So where are we going? What kind of leadership from doctors and our especially politicians when everybody's unhappy and everybody's confused? And that's what we're. I'm not saying COVID doesn't need to be treated. I'm okay with that, but the way it's being managed, especially by politicians and the rhetoric coming out, I question it a lot. Some of the other, and the last point I'll make before passing it to others is that also in the islands, in the islands, the discussion also knowing that they don't have access to to Moderna and Pfizer, a lot of them, they started taking AstraZeneca and it's been refused, or they can't really travel to our western part of the world with that vaccine. So it creates a lot of frustration, a lot of confusion again, and people are just basically have to redo the whole thing. So it brings skepticism, to say the least, also. So the cheap, there seems to be a cheaper vaccine given to African countries, to poor countries. Maybe someone can deny or correct me if I'm wrong, but that's what we're hearing. And that, so again, people of color, people of countries that are in development, in the islands and so on, would be again, sideline, would be again a second and third class citizen. So that brings a lot of sadness and obviously negative experience with the health system. Obviously, we know from the First Nation, but some Blacks have also experienced that. So quality of vaccine are subject to debate amongst Blacks, and I'll stop that now. Thank you, Omar.
Perfect. Thank you, Michael. And we appreciate you bringing a different perspective to the discussion and speaking from your experience with those who, from the community. So thank you for that. So I see a hand that is raised here. So Horace Laria.
Yes, I'm a medical doctor.
Hello.
I just want to assure the gentleman that this thing in no way will change your DNA. It's not a virus that attaches to DNA to change it. So it won't do it. The vaccine won't do it. And what I will say is that if 97% of doctors have received the vaccine, it can't be that dangerous, If 90% of the doctors have submitted themselves to receive the vaccine, it can't be that bad. I mean, I don't see how doctors will be so foolish to take dangerously expose themselves to something they think is inherently bad. I don't see that. The reason for the third world receiving the AstraZeneca is what the World Health promised to give it, and that's what was available at the time. America has offered to give some vaccines. It could be AstraZeneca, but they also offered other vaccines. So whatever is available will be given to the third world. Some people in Canada did receive AstraZeneca too. I mean, so it wasn't like it was not given at all to Canadians. A lot of people have received AstraZeneca in Canada.
Perfect. Thank you. So do we have any other questions? Great. If not, thank you so much, Michael, for your presentation. Oh,
okay. Why don't we have a doctor on the panel that's a real doctor? I mean, because there's Dr. Kessner, but he's not a medical doctor. He's, I think, a psychologist or something. So why isn't there a regular, medical doctor on?
So we had medical doctors the last time, as I believe you were present at that event.
Yeah, I was.
Yeah. So as we had mentioned at each event, at each series, we do bring in different professionals. So so this second part, we have decided we chose these specific speakers. We'll definitely take your point in consideration though for future events.
Yeah, because it would be much better. Like you could talk to a real, not to say the man that just spoke isn't a doctor, but the other guy, Dr. Kessner, he's only.
Dr.
I'm a real doctor. I'm a real doctor. So
yeah.
Okay.
I'll stay on and answer questions if possible. I'm a hematologist oncologist. So I'm versed in what we are dealing about. Yeah.
Are you in Montreal?
Yes, I'm in Montreal. I'm at McGill. Yeah.
You're at, sorry, I didn't hear that last part.
Pardon?
I didn't hear the last part. I heard you say Montreal, then you said something else.
I'm in Montreal. I'm also at McGill.
Oh, okay.
Thank you, Dr. Laria.
Okay.
All right. So without further ado, we'll pass on to our next segment. And so, Sophia, I'll give back the floor to you.
Great. Thank you so much, Michael. And if other questions come up, like, well, we're going to have more opportunities to have these discussions throughout the rest of the evening. So we're going to move on to Dr. Kessner's presentation. I see that you have shared your screen. So
yes, is that okay if I do that?
Absolutely. Yeah. I will just introduce you if that's okay.
Okay. Yes.
So welcome, Dr. Kessner. So Dr. Richard Kessner is a professor of psychology at McGill University. He completed his PhD at the University of Rochester and a postdoctoral fellowship at Harvard University. He is the founder and director of the McGill Human Motivation Lab, and he has published over 200 scientific articles. Dr. Kessner recently won the Canadian Psychology Association's Donald O. Hebb Award for distinguished contributions to psychology as a science. In 2007, Dr. Kessner received the Canadian Psychological Association Award for Excellence in Teaching, and in 2008, he won the Principal's Prize for Excellence in Teaching at McGill. Dr. Kessner is a leading proponent of self-determination theory, and his recent work focuses on the psychological effects of the COVID-19 pandemic on Black young adults. So thank you so much for being with us this evening.
Yes. Thank you very much, Sophia. And we have to shorten that introduction. Sorry about that. What I want to talk about is who are the unvaccinated and how can we reach them? I do want to acknowledge that I won't be able to touch on some of the things that Michael brought up in terms of what's happening on the streets and cultural and religious issues. And, I'll try to talk about them at the end if I miss some of those important things. But I was approaching this as we've been in the pandemic for, I guess, 18 months. We've had the vaccines for 10 months, but it seems like we're still stuck to some extent. And the epidemiologist earlier said that, eventually we may all end up getting COVID. So I'm focusing this talk on who remains unvaccinated and are they reachable? So some of what I'm saying will be based on an article that was published a couple days ago that reviewed all the research that's been done, survey research with the unvaccinated. And the title of the article surprised me, but convinced me. The article suggested the unvaccinated may not be who we think they are. And the article highlights how diverse the unvaccinated are as a group. I'm an American and I figured all the unvaccinated were Trump supporters, but that's not true. There's some Democrats, there's some liberals. In this, at this vaccination clinic that you see here, you could see there's Black adults, there's white adults, there's younger people, there's older people, there's a guy with green hair. So you see a lot of diversity. If you actually talk to these people, I think you would find that some of these people who are just now getting vaccinated are very religious and some are not so religious. So there'll be a lot of diversity. Now, I think many of us, when we think of the people who are resisting getting vaccinated, we think of anti-vaxxers who also might protest against having to wear masks, for example. That turns out to be a very small group. They're a loud group, but a small group. So it's only about 4% of the unvaccinated could be described as against all vaccines and against masks. So that's not as big a group as many of us would imagine. Now, there's two things that I believe are true of most unvaccinated people, even though they're very diverse. The first thing I think, and I was proven wrong about this the last time we had an open house, I believe that most people who are unvaccinated are unlikely to come to open houses about vaccination. And they're unlikely to look for information on the internet about why they should get vaccinated. They may pursue, questions they have. But what I worry is that we may not reach a lot of the people we would like to reach with these kinds of events. So the other thing that I believe is true is that all of us here today will meet friends, neighbors, and acquaintances who have been wrestling with whether to get vaccinated or not. So all of us will have a role to play. And I understand that our beliefs are different and our realities are different. But for those of us who believe that vaccinations are important, we have a role in how we listen to other people and the kind of dialogue we engage in. Because there's a chance we could help people resolve their ambivalence or correct some of the misinformation. Okay. Now, in the latest results from all of these surveys, they actually split the unvaccinated into two groups, and I wouldn't have thought of doing this. There's one group that are called vaccine resistant. They're pretty sure they don't want a vaccine, and they have their reasons for doing that, but that's a relatively small group. It's that 4% I was mentioning, maybe a little more, 6%. But surprisingly, most of the other people who are unvaccinated are actually willing to get vaccinated. They actually believe the vaccines are helpful. The problem is many of them think they have a unique situation. For example, the one member said they have inflammatory bowel syndrome, or they're concerned about how that might affect the vaccines. There are many people who are hesitating because they have diabetes, because they have muscle atrophy, because they have a heart arrhythmia. And in fact, with all of those things, the medical evidence seems to suggest we should get the vaccine. But people don't know that because most of us don't have family doctors. We don't have children who are doctors, and we can't really get those questions answered very easily. But so there's vaccine resistant, which is a small group, and I'll show you, I think there's only one way to convince them. But then there's the vaccine willing, who I think are working toward getting vaccinated, and many of them have. Now, the question then becomes, when you have a neighbor or a friend or someone at the Y, how do you figure out whether they're resistant or willing to take the vaccines? And I'm going to give you a recent, much publicized example that I think will surprise you. So there's an amazingly successful, popular rap singer named Nicki Minaj. I listen to her music. She has amazing lyrics. She's like a poet. There is a lot of cursing in it, and I didn't understand all of it, but she's incredibly popular. But she gained a lot of attention because 2 weeks ago, she posted on Twitter this tweet that I'm now going to read. She said, "My cousin in Trinidad won't get the vaccine because his friend got it and became impotent. His testicles became swollen. His friend was weeks away from getting married. Now the girl called off the wedding. So just pray on it and make sure you're comfortable with your decision. Don't be bullied." And that alarmed epidemiologists, public health officials, doctors, and community leaders, because Nicki is very influential. She has 150 million followers. And that communication, it tells a very powerful, compelling story. And if it were true, it would freak out a lot of people. So I look at Twitter too, and sometimes I'll see something which says, "Oh, my friend just got Twitter and now he's blind." Or I know a person who got Twitter and died the next day. And these kinds of anecdotes are very emotional and very powerful, but quite often they're not true. And in Trinidad, the health officials tried to find this person who became impotent and had the problems with his testicles. And there was no sign of this person. They could not track it. So it seems like this may not have been a real story. And so the question is, what kind of harm can this do in terms of triggering and reinforcing people's worries? So Nicki actually was worried about, oh boy, maybe this wasn't the right thing to say. So then she came out and she had another tweet, and she said, holy cow, I can't actually read it because my panel is over it. But she said something like, I'm not really let's see. Can you read it, Sophia?
She says,
oh no, I can see it now. Okay.
Okay.
She says, "I've not done enough research yet. People should keep safe in the meantime by wearing the mask with two straps and grips that grips your head and face, not the loose one." What's so surprising about this is she clearly believes in the importance of masks and in the importance of staying safe. And she even knows about the N95 mask and how those are the best ones. And in fact, it's very likely that she believes that COVID is dangerous. But despite that, she put out this tweet. And I think this is an example of someone who actually would be willing to consider vaccines. However, there's something unique about their situation that's holding them back. So I'll talk about what some of those things can be. But I'll begin by saying I actually think Nicki Minaj, she's in this willing to take vaccine category, and that's where most of the unvaccinated are. Now, I have a friend, an acquaintance who I met this summer, who I had known for a long time from the YMCA and from the church, and he's a scientist. And when he met me, he really surprised me because I was wearing a mask and I'd been vaccinated. And I said, Joe, I've been vaccinated, but I'm still wearing my mask. It looks like you're not wearing a mask. And he says, oh no, I haven't been vaccinated and I never wear masks. And that surprised me because he was coming up to talk to me, and maybe I'm a little phobic of people who are unmasked. And at that time, I was still quite worried about, could I catch COVID? So what I said was, yeah, I know some people don't like to wear masks and they may not be ready to be vaccinated, but you're not one of those people who marches in those rallies downtown against masks. And then he really surprised me and said, yes, I was bicycling down there and I saw a march. I met some of the people, and I've been going to these events, and I'm part of this group on YouTube. And that really surprised me, and I didn't know what to say, but I talked to him all the time about his brothers, his sisters, his mom. And I said, what are they doing? And he said, well, none of them are masked and none of them are getting the vaccine. So then I thought, okay, it's a family thing, and maybe the whole family has decided. But I knew that he had two kids who are in university. One of them just graduated. And I said, well, how about them? Did they get vaccinated? And he says, yeah, they did get vaccinated. And they always wear their masks, even when they come visit. And I thought that gave me an opportunity to say, oh, that's interesting. So there's a difference there. Why do you think your kids believe in vaccines and wearing masks? And he says, they don't understand science. They don't realize that COVID is no worse than the flu, and that there's no evidence. There's absolutely no scientific evidence that the vaccines work. And I know he's not right about that. There's lots of evidence that COVID is worse than the flu, and that the vaccines do work, and that they've saved many people's lives. And I just could not figure out why he had these beliefs. And it really kind of shocked me. So I made an excuse to rush home. I said I had to get the lasagna out of the oven. But after that, let's see, I started thinking, okay, was there anything in the 20 years and in the over 200 conversations that I've had with this fellow that might have given me a clue that he would end up on that side of this debate? And then I remembered that at the Y, both of us had knee injuries, and both of us couldn't even run on a treadmill anymore. And we had both been trying to get fit. So I tried everything I could to get help for my knee. I wore a brace. I went for physiotherapy. I started doing aquatic jogging. None of that helped. So I had arthroscopic knee surgery. I then hurt my other knee, and I got arthroscopic knee surgery on that. Every step along the way, I would talk to Joe and I would say, boy, my knee's still bothering me, so I'm going to try this. I'm going to try this. And at every point he said, oh yeah, I wouldn't do that. And then he explained he hadn't seen a doctor in over 20 years. And he has no intention of ever seeing a doctor until he is like, an ambulance has to take him there. And what became clear to me is that for some reason, even though he's highly educated, he has a great family, he's a great person, he has an incredible distrust and lack of faith in doctors and the medical system. And I didn't know where that came from. But something that I do know is that one of the distinguishing things about Black communities where there are low vaccination rates is that the trust in the medical system is also very low. And it's been suggested that for most of the unvaccinated, the heart of the issue is a lack of trust. Now, when you think of the Black community, you think of some of the things Michael mentioned, which is the terrible experiments with Tuskegee. And then you think about the stories about McGill University and the LSD. And it was the case that it was particularly Black participants who were mistreated in that way. But the other thing Michael said, which is 100% I agree with, is that it's not all historical. It's like most Black adults have the experience, either their own or in their family, of someone going to the emergency room and having to wait a lot longer than the other people seem to have to wait. Or they have the experience of having intense pain and not being offered pain medication. So there's a lot of systemic negative experiences that Black individuals have. And the other thing that happens is your parents and your grandparents tell you about these experiences. So if it is historical, it's a living history. But so at the heart of what is probably happening in Black communities is this lack of mistrust. So one of the things we're going to have to deal with is how to increase that trust. We're hoping that these open houses can do, these open forums can do it. But I think the one person who said, well, we need more doctors here, that's probably true. So here are the possible reasons for not getting vaccinated. The most common is I have a special situation. So I have a heart arrhythmia, I have cancer, I have diabetes. Almost all of those situations, you can still get vaccinated. The doctor should inform you. It should be monitored carefully. You may get one vaccine or another vaccine. But the danger is that if you keep waiting and waiting and waiting, you may well catch COVID, and that can be deadly. There was a tragic situation of a couple in their 30s who had an 8-year-old daughter, and the husband had diabetes, the wife had another problem, and they thought they'd get vaccinated at some point, but they just wanted to wait a little longer. They both got COVID-19. They died within a week. And there's a danger in not deciding. It's hard to decide because then you feel responsible. And there's all of these ideas about the vaccines, but there's a great danger in not deciding, especially with the Delta variant that's so transmissible. Now, the second thing that I believe Nicki Minaj would have said this, she's not getting vaccinated because she has a young child. I'm guessing she has some concerns about fertility if she wants to have more children. And as the epidemiologist said, and I'm sure as a doctor who's here will say, there's no evidence, and they've looked for it, that vaccines cause infertility. Some people may become infertile, but it has nothing to do with the vaccine. But if you have, 30 million Canadians getting the vaccine, some people will become infertile. But if you look at the unvaccinated and vaccinated, there'll be no difference in the rates. Now, the third thing, this came up at our last open house. I thought this was really hard to answer last time I was here, was we don't know about the long-term effects. What happens in 5 years? What happens in 10 years? Because a lot of drugs do have long-term effects that don't show up right away. It turns out, however, vaccines are not like other drugs. They are made with relatively safe materials. They use a part of the virus to trigger a reaction in your body, but it doesn't change your DNA. And there is no mechanism by which the vaccine can have long-term effects that wouldn't show up in the first 2 months, say. So we'll ask the doctor whether that's accurate, but that's what the doctor who was here last time said, is that you have to understand vaccines are different from other drugs. They're simpler, and if they have side effects, the side effects you'll see relatively soon. And there's no biological chemical mechanism that could explain how a vaccine could have no effect, no negative effect early, but then 5 years later. And it's not changing the DNA. They know that. Okay, the last thing I'm going to show you, the last reason, you see how it's all in small print and it's very light? I do that purposely because there is one thing that keeps many of us from getting vaccinations, and we're afraid to tell other people about it. And that is, many of us have needle phobia or injection phobia. People are afraid of being injected. Some surveys suggest about 25% of the unvaccinated maybe have this kind of phobia. And you might, like all of us, are a little afraid of an injection. But for someone who's phobic, what it means is they might have a panic attack. What it means is they've probably fainted before when they got an injection. So that's kind of an embarrassing secret that they don't discuss with other people and that prevents them from getting vaccinated. And that's a solvable problem. And healthcare and other people should talk to people who might have this fear, because doctors can help with that. You can take a small anti-anxiety medication right before your vaccine. You could arrange it so that the same nurse gives you the vaccine both times. You can arrange it so you could go in a private room and you feel more comfortable. There's also some psychological things to desensitize you. But so these are the four main reasons for not getting vaccinated. I think they are all legitimate, but they are all solvable. And this is why a lot of the people who are hesitating may actually be willing, if we could just make them comfortable telling us about what their concerns are. And if we could have a doctor, because as the person who spoke before, people trust the doctors most. However, even sometimes that's not even there. Okay, so let's see, I should be winding down here. Now, the other thing that people will say is, why should I get vaccinated? You could still catch COVID, even if you're vaccinated. There are these crossover breakthrough cases. That is true, but what you have to remember is that the percentages are much lower for people who are vaccinated. So people who are vaccinated are 16 times less likely to show up at the hospital or to die than people who are unvaccinated. Now, this is actually really important because there's new research which suggests that these breakthrough cases for people who've been vaccinated twice are more frequent in Black communities and in Indigenous communities. So you may have a sense that people in your community, holy cow, they've been vaccinated twice, but they're still getting COVID. Why should I bother? Now, there's a reason, and it's a systemic reason why Black communities would be more likely to get this breakthrough, and that's because they're exposed more frequently to the COVID virus because they tend to be frontline workers. They're less likely to work from home like I do, and they live in crowded areas. However, even with all of that being true, for a Black person who is doubly vaccinated, they're 12 times less likely to have to go to the hospital if they catch COVID than someone who was unvaccinated. It's not as high as among white people, but it's still a big, big help. Oh, I see someone, okay. Okay, I'm coming to my conclusion, which is we're likely to have people in our life who are unvaccinated. People have diverse reasons for the hesitation. And in most cases, they're good faith arguments. They're personal reasons. It's only a small percentage who are like radically against vaccines and masks and who say it's all a hoax or conspiracy. Very small percentage. So people have diverse reasons. We should try not to be angry, scolding, or rejecting. No one responds to that. Instead, we should try to listen. We should try to be open. I think we should see if we could ask a question or make a comment or talk about our own experience in a way that can help people feel a little more ready to consider vaccines. I think there's a chance that this will work with some people. And I believe most of us here today, if we have been vaccinated, will feel good about reaching out to a neighbor or a family member and engaging in this kind of conversation. Some of them don't have access to doctors, and some of them would probably be helped by a conversation, an open conversation, a non-judgmental one. Now, we're coming to the question period, but I'm going to ask myself the first question because I think there's a really important question here, which is, Richard, it's very interesting what you said, but how about those 4% of the people, like your friend Joe? What can we do to reach them? Should we just give up on them? Should we say, okay, you have your freedom, you do what you want? And that's what I said last time, a month ago. Now I'll tell you something different. And I'm sorry this might provoke some of the people in the group, but I hope that there's a clear mandate from public health officials and from the government that we all have to get the vaccine, either for work or to go to Montreal Canadiens games or to go to the Y. And the reason I say that, I know it's intrusive and I know some people will get upset. There's a lot of evidence that if your goal is to vaccinate the community, mandates work. So in the United States and in Canada, if you're a healthcare worker, if you work for an airline, if you work for Fox News, which is the major disinformation outlet in the world, in all of those organizations, there are now mandates. And when people were surveyed about mandates, 72% of the unvaccinated said, if they give me a mandate at work, I'm quitting. I'm out of there. I'm looking for something else. Do you know what percentage have actually quit their job when a mandate was enforced? 0.03%. So that when push comes to shove, and it's unfortunate that people feel shoved, and I know that this is controversial, but people get the mandate. People get the vaccine. So I actually think my friend Joe, what he loves more than anything, he's retired like me, he loves to travel the world. I haven't seen him in 3 months. I would not be surprised if, because of his love of travel and because the airlines require the vaccination, he's probably been vaccinated. I'd be really interested to see if it changes his opinion. But I know it's controversial, but I hope that my friend Joe had to face a mandate and that he decided to get vaccinated because of that. Because I know that if he had his vaccine, as a guy who's in his late 60s, he's much more likely to avoid getting COVID. And he's much more likely to survive for his wife and his kids. He's also much more likely not to catch something that he would give to his wife and kids. So from the point of view of someone who cares about him and other people, I really hope that the mandates might push him to reconsider his belief that the hoax, that the COVID is a hoax. I also hope, but I don't know, that once people get the vaccine and they see that there's no crazy side effects, and they see that they're not catching COVID, and they see that there's a certain amount of freedom to move about, I hope people can like rethink why they were on the other side and they were so strongly against the idea of a vaccine. Okay, sorry for going so long, and I'll stop there.
I have something to say.
Sure.
Okay, I've been vaccinated. Because the last time I wasn't vaccinated when I was on here, and I'm vaccinated now. I'm still waiting for the second one. I was supposed to go today, but I wasn't able to. But I still don't believe in it. I'm not saying I can't get COVID, but I just don't like another thing, people forcing you into something, or they're bribing you. They're going to give you money to do it. I don't think they should do that. And I'm still against the vaccine, and I find that I'm just going to finish. And I just find that people should not be forcing you. If somebody doesn't want to do it, let it be, because I didn't want to do it, and I only did it because I wanted to meet my family in the States that I never met before, and because like you want to go different places too. You can't travel without the vaccine. That's the only reason, main reason why I did it, to see my family. Otherwise, I wouldn't have did it.
Yeah, well, I'm glad you mentioned that. And public health officials know that people don't like being forced. And they've actually done experiments, and they realize it's much better to get people to volunteer. And these mandates are a last resort. We've been in the pandemic for, 18 months or something. And in North America, 800,000 people have died. And if you look at the statistics in Quebec, it's still spreading. The numbers never go below 400. Now, you bring up freedom, and I'm not a doctor, but my research is about autonomy. For 32 years, I've been studying autonomy. And there are two ways of thinking about autonomy and freedom. One way is the way, we do both things, but one way is to think of it as independence. I have to be independent. No one should tell me what to do. And I will react and fight and resent if anyone tells me what to do. I'm going to let's call that independence. Now, true autonomy actually is something where you think about other people and the community, and they study the development of autonomy in young children, and autonomy grows out of a secure attachment with the mother and father. So autonomy is essentially connected with your family, with your community, and with the larger world around us. So there's two ways, I think, of thinking about autonomy, and people get it confused. I would call it me autonomy and we autonomy. And I know, in fact, I've gone to some of these meetings, and in the Black community, they think about the we, and they highlight the we and how we should be thinking about the group and others. And I think from that perspective, I really think you have to consider that you can be autonomous. Autonomous doesn't mean deciding on your own. There's no world in which we get to decide everything on our own. When we were children, our parents told us what to do. In school, teachers told. It's a matter of whether people tell you in a way where you can think about it, accept it, and make it your own. That's what we're trying to do here. It's ultimately still your decision. But I do want to say that I don't think autonomy means, and freedom doesn't mean that you're free to do whatever you want and no one can give you advice. I mean, we have to wear seatbelts. We have to do certain things for our kids. We have to get our kids immunized. And it's really important that the doctors and other people explain the rationale and why it's important. But there is a legitimacy to being worried about the community and worried about the group. And I think that's what happens in a public health emergency like we've been in. There is a doctor here. Maybe the doctor could say something about that. A real doctor. Horace, would you want to say something about that?
No, what you said is true, but you have to think also about others. That's what is important too. Even though you have the right not to have it, but how about if you were to make somebody else sick? How would you feel? That's the problem. And this is something that we know that the vaccine works, because you can put a graph up that the time they started the vaccinations and people dying, you can see the age group of people dying. When they started with the old people, the death rate for the old people and the hospitalization went right down before they started the age. You can see the graph going down. So the vaccine was definitely effective and preventing hospitalization and preventing deaths. And the side effects of the vaccine are much less than if you do get the COVID.
Yeah.
And even those who get asymptomatic COVID, there could be long-term side effects. And some people may have symptoms or side effects with the lung or even the heart and with the muscles 6 months after they've had what they call asymptomatic infection. So, COVID is not a small thing to sneer at. It is not like the flu.
Yeah, I agree totally. But we may be running out of time here, Omar and Sophie. I'm sorry I went long again.
No, that's all right. Yeah, we'll move on shortly to Sita's presentation. But just thank you very much, Dr. Kessner, and looking forward to continuing these discussions. Thank you so much for your presentation.
You're welcome.
So I'm going to share my screen to show Sita's presentation. Share. Actually, let me just see. Sorry, before I do that, I'm going to introduce Sita, of course. And that way we can continue. So Sita Ramdas is the former director of communications and public relations at St. Mary's Hospital and is the current member of several hospital emergency measures planning teams. Sita Ramdas is known for her dedication to raising awareness of sociocultural inequities and to collaborate in advancing equitable healthcare delivery through cultural consultation, training in equity, social inclusion, cultural safety, and unlearning racism, working with local and international groups. Her background in communications and media relations enables her to deliver targeted messages that help to advance the efforts of equity, inclusion, and advocacy for diverse and vulnerable communities. So welcome, Sita. Thank you so much for joining us this evening. I will now share my screen.
So as you're sharing my screen, I hope everyone can hear me. And thank you very much for the opportunity to participate in tonight's forum and to share my presentation with everyone and to hear also your interesting perspectives and contributions to tonight's event. So my background in healthcare, it's more than 25 years in Quebec and Montreal, and a lot of it has been very community affairs oriented. One of the lessons that I learned very quickly, if you go to the next slide, very early in my career, is that there are big inequalities in healthcare when it comes to ethno-racial communities and marginalized groups. Yes, if you can go to the next slide. Number 2.
Yeah, sorry, I'm just having an issue changing slides. It did that before. I don't know why. If I do, so strange. Sorry about this little hiccup.
Okay.
That's odd. I'm not sure why.
If it's having trouble, what you can do is maybe I can try to share it from my own screen if it seems to be giving you a hard time.
Try one last thing here. I'm going to stop the share and reshare.
Sure. So I'll just move forward to share what my points were. So,
oh, there we go. Sorry.
I discovered very quickly that ethno-racialized, marginalized communities were not getting equitable access to healthcare if they were getting any at all. And so I took it upon myself, because my job is public relations, to try to reach out and engage with those marginalized communities that couldn't get something as basic as an appointment to see a doctor. And I went out and I reached a lot of our youth from Black community. I started with the Black community because I am West Indian of birth, although I have grown up in Montreal, Quebec. And I went back to the schools and in the Côte-de-Neige neighborhood that I grew up in, and I started there with a community with whom I'm very familiar. And as I move forward in my career, I also organized different community symposiums, much like this one, but they were live, where I engaged with community members from different ethnocultural backgrounds who are minority groups and also marginalized groups. When I say marginalized, I mean people like the homeless, who don't ever get a forum to share their points of view, but we tried reaching out to them and getting their feedback. And I got a lot of complaints from these patients about how difficult and challenging it was for them to get access to healthcare. If you go to the next slide. And, there's some very famous cases of how our healthcare system has really been a seriously incompetent when it comes to people from marginalized communities. We're very familiar with Joyce Echaquan and what happened to her. She managed to document what her experience was. Prior to her, there was a gentleman, Brian St. Clair, another Indigenous man years earlier, who himself was neglected and actually died while waiting in an emergency room for treatment. Akeem Scott, a 26-year-old who, this is in Montreal, and this is just a couple of years ago, he died of a very treatable ailment. He could have been treated and he could have been sent home in good shape, but instead he suffered in pain for 4 hours in a local Montreal emergency room. Mireille Nojomo, she died just months ago, again in another Montreal hospital. Even though she told healthcare workers that she's allergic to a drug, they gave it to her and she had a reaction and died from that. And then there are cases like one that happened just a couple of months ago with another person from a minority group who reached out to me at about 10 o'clock in the evening, was suffering COVID positive, unable to breathe, struggling to breathe for 7 hours in an emergency room, and was such an invisible minority, they didn't even put a hospital band on this patient. So had she died on the floor, she was literally on the floor because she was too weak to stand, they wouldn't have been able to identify her. If you could go to the next slide. So, and even when you do get access to healthcare as a person who is racialized or marginalized, even within the healthcare system, some of the technology itself is actually very racist. The pulse oximeter, which is the device that's you see pictured here on this person's finger, it's used to tell how much oxygen is in a patient's blood. And it is a device during COVID that is very important for telling you how much oxygen a patient has. Well, studies going back to 2007 have shown that the pulse oximeter does not read accurately when it's placed on dark skin tones. It gives false high readings. So it shows the patient has more oxygen when they actually have less. And so many patients who are dark skinned went home. They were discharged during this COVID pandemic and sent home earlier, thinking that they were recovering from COVID because their oxygen levels seemed to be better, when in fact they weren't. And those patients, many of them went home and died at home, or succumbed to the disease further and ended back up inside of the hospital. So, even with the best intentions, we see within the context of these healthcare technology, there is discrimination against various minority groups. We can go to the next slide. And what my experience has shown me is, and what motivates me to advocate for vulnerable communities, is that part of the vulnerability, it falls on us to make the powers that be, the healthcare system, aware of what's going on, but we have that general distrust of the healthcare system because of the history we've encountered, as has been pointed out by Michael and by Dr. Kessner. We've had a history where we've been denied information that allows us to make an informed decision about our healthcare. We've been denied full transparency about something. Language, certainly in Quebec, can be a barrier for us to getting care. There's a lack of respect, often because of our accents, the way we speak culturally. The white mainstream healthcare providers may not understand us, or conversely, we may not understand them. And so I'm not going to go through this whole list with you, but this is a short list of many barriers that communities that are vulnerable have to accessing great healthcare. Next slide, please. Well, what's interesting is this COVID pandemic comes along, and what COVID does is something I consider actually a positive. It magnifies, it amplifies what myself and a few other healthcare advocates have been saying for over a quarter of a century, that there is a problem. There is not equitable and safe and inclusive healthcare for racial and ethnocultural and marginalized groups. They are at greater risk because they don't get access to the system. And COVID-19, fortunately, but unfortunately, pointed that out. And so we know from the data that it has affected many ethno-racial groups. They are at higher risk of getting COVID-19. You can go to the next slide. I hope for my translator, I'm not going too fast. I had shown this at a presentation not too long ago, but the Statistics Canada 2016 statistics had projected that by the year 2036, about a third of Canada's population will be people of color. But given that the CDC and other studies have pointed out that people of color are 6 times more likely to get sick and die from COVID, I think this number is actually going to come down. Next slide, please. I won't go through a lot of the scientific details about COVID because those were well covered by our first presenters, but I just want to put it in perspective. To date, about 5 million people have died of COVID. Now, if you just go down to the third line, Ebola, which has been depicted as a very graphic disease, people are bleeding from their orifices, from their nose, from their ears, has claimed about 12,000 lives. If you look further down at the bottom, the Spanish flu, which was about a 2-year period, claimed 50 million lives, 1918 to 1920. That was when we didn't have all the scientific and sophisticated medical equipment and stuff that we have today. So just to put that in perspective, today, in the last 18 months, despite all the sophisticated knowledge we have in healthcare and medicine, we have still lost 5 million people, and that number is growing. Next slide, please. So there's a lot of things about COVID that I think you already know. I want to focus on what's highlighted here. COVID-19, it is such an insidious disease that it is infectious before you become sick. Now remember, my role in healthcare is healthcare communications, and I focus on just getting facts out to patients, but facts at a literacy level that patients and the population, the community can understand. So please understand it. You can become sick and you don't know it. You are infectious and you are getting other people sick and you may not even know it. And as pointed out by previous presenters, Sometimes you have symptoms and you are clearly showing them, and sometimes you are asymptomatic. But for certain people who might have mild symptoms, they're the fortunate minority. A lot of people end up getting severe symptoms and they're hospitalized and they can die. Next slide, please. Am I going too fast for the translator? I'm just double checking. You already are very familiar with the symptoms of COVID. I'm not going to go through that list. I think you're all aware of what COVID can cause: fever, coughing. We all know it attacks the lungs, so there's a lot of problems breathing. I won't go through the whole list, so I'll go to the next slide, which is about the long-term effects, which was touched on by our wonderful Dr. Horst. The long-term effects are what you will experience if you recover. If you're fortunately enough that you recover from COVID, many patients report having fatigue, shortness of breath, difficulty breathing, brain fog. Imagine that you have memory issues and you have to go back to work. You have to resume your activities, or you're a mother who is in managing and the administrator of your household, and you're having difficulty with remembering things. Loss of smell or taste, depression, anxiety. And recent studies that I've been reviewing for Diabetes Action Canada have shown that among patients who have recovered from COVID, they have been left with diabetes as an emerging effect of having had the disease. It seems that COVID-19 can affect the beta cells, which are part of your insulin producing system in your body. If we could go to the next slide. And further to that, so if you survive COVID and you have some of those long-term effects and you're willing to live with some of those long-term effects, here's some other things to think about. There's organ damage that could be caused by COVID-19. And again, we're aware that this virus attacks the lungs, so we can expect that there would be long-term breathing problems. But there's also information that this also may affect the heart and cause damage to the heart that will increase the risk of heart failure or complications in the future. For the brain, for young people, it can even cause strokes. It can cause seizures, as in Guillain-Barré syndrome, which is a syndrome that can lead to temporary paralysis. It may increase the risk of developing Parkinson's and Alzheimer's disease. And that is if you survive COVID. These are some of the long-term possibilities that you now will face. For people who already have pre-existing health conditions, there are other inflammatory issues that they can face with their different organ systems. If you could go to the next slide, please. As it's been explained, the virus makes its way into your body. You become a host of this virus. And I put this in here because I wanted to address the idea of consent and Dr. Kessner's expression about autonomy. When the virus invades your body, it's not asking your permission. It's not asking your consent, right? You don't get to choose. It goes into you. And I'd like you to think about an analogy for a second. You think about someone invading your home. You have an uninvited guest who settles into your home and takes the best nutrients from your home, sets up in the best room, makes itself comfortable, and then starts replicating itself and sucking up all your other resources of your home. I doubt any of you would welcome that. Well, this is essentially what the virus is doing within your body. And it is taking your body's essential nutrients and the best of your body to sustain itself and make copies of itself. And in so doing, it is destroying your own vitality. Next slide, please. And the virus has, without permission and without consent, taken over and inhabited the bodies. If you look here, this is from October the 18th, so it's about 3 days ago. Across the planet, 241 million people's bodies have been invaded by this little predator. If you go to the next slide. In Canada, we're looking at about 1.7 million Canadians who are victims of this, again, invading little predator. And if you go to the next slide. Thank you. You can see that in terms of the cases, if you look at our city, Montreal, we're closing up on 150,000 cases. The next slide will show you that to date, we have in Montreal about 4,800 deaths. So this bacteria, again, this virus, as you're looking at the numbers, you can see the more crowded the places are, the higher the incidence of spread, the more victims, the more lives are lost, because this invader has more hosts that it can inhabit. The next slide, please. Early on, when COVID struck, we were really hearing a lot of how it was affecting elderly people. They seemed to be the most vulnerable population at the time. But viruses are very smart. They're essentially a program of knowledge that comes into your body and invades your body. And that program rewrites itself and creates other viruses within your body. And we've been hearing the variants. So that tells you these variants is that the virus is very quick at adapting and at learning. So whilst it may have started off and it was easy to target elderly people, if you look here at the numbers, all age groups now, even 0 to 9 years old, are at risk and can be affected by the virus. Next slide, please. So what do we have as any kind of defense against this virus? Well, I'm not going to go into the details because we had a lovely presentation on the vaccines. There are a lot of them that are available. One of the ones that is most lauded, of course, is Pfizer. I just want you to note that Pfizer costs about $20 US per dose. There are different levels of effectiveness of the vaccines. Regardless of their levels of effectiveness, the point is that they do give you a fighting chance against the virus, because what the vaccine essentially does, it is a program. It is made up of a bit of material from a virus, not of the virus itself, but of a protein. And that program, that information is given to your body to help your body to fight or combat this virus. So if we could go to the next slide. There are about 60 vaccines that are in clinical development and about 172 in preclinical development. While this may all sound like, oh, all these vaccines are new, in fact, the National Institutes of Health have been studying coronaviruses for decades. And from their studies, they've been practicing on making different kinds of vaccines that could be deployed and could be used if we needed them. If we jump to the next slide. What COVID has done is COVID has created an unprecedented situation in that it brought together the collaboration of top scientists, government, industry, volunteers, disease centers, and healthcare organizations. It brought them together. These are groups that would normally compete to see who could make a vaccine first, but they came together to protect the people of our planet. They combined their talents and they created the vaccines. And what do these vaccines do? Well, they are effective at protecting you from getting COVID, especially from the severe illnesses and the severe symptoms that occur. They can reduce the risk of spreading the virus to others. And once fully vaccinated, you can resume your activities that you did before the vaccine. And as I pointed out, the vaccines they're not live viruses. They're programmed information that teaches our bodies how to fight COVID-19. Jump to the next slide, please. So what the vaccines do not do, they do not contain any live virus. They do not contain microchips. Microchips cost about $200 for a microchip. We're about 38 million people in Canada. If you do the math, that is a whole lot of money that our government just does not have to spend on microchips. It also makes absolutely no sense. They do not interact or change your DNA in any way, and they do not give you COVID-19. They can give you some symptoms that look like a flu, but you will have these in a milder form as opposed to getting the actual disease where these can actually be very intense and lead to hospitalizations. Next slide, please. if we all were to get vaccinated, we can actually help protect not just ourselves, but we protect our loved ones, and we protect our communities. Essentially, we can achieve population immunity by thinking about ourselves so that everybody can get back to a state of normal. And here I'd like to ask any of you if you ever heard of the Arawak people. And if you haven't, don't be surprised, because they, like many other groups of people across the planet, across history, are entire communities who disappeared. They're extinct because they were eradicated by different kinds of disease and suffering. And so if you can have something to have prevented that, protect them from that, such as a vaccine, maybe some of them would still be around to share their culture with us today. Next slide, please. And if you think that just hand washing and mask wearing is enough to protect you from getting the disease, I spoke to people who are experts in keeping hospitals clean and sterile and safe. And I did quite a bit of research into this. And what's interesting is that the COVID-19 virus can survive on certain surfaces for up to 28 days. So it's not like you can just get rid of it. It can be around for a good month. And if you go to the next slide, give you an example. On glass, such as windows and mirrors and drinking glasses, that could live for 5 days. On metal, things that you might touch all the time, a doorknob, jewelry, cutlery, 5 days. Here is one that I find very worrisome. Plastic and stainless steel. You can see that, many things are made of that. Sinks, where you might go to public sinks and washrooms, touching elevator buttons, the rails on the stairs in the metro system. You're talking that this virus can live there for, up to a week. So it is a persistent and determined little invader to stick around. Next slide, please. Some other fallout of COVID-19, and as a patient advocate who is constantly on a daily basis receiving patient complaints or requests from patients for assistance, I can tell you that a big concern that we have right now is the fact that the ICUs, it's getting a little bit better, but they have been overwhelmed with COVID-19 patients. So that means that if you get into a car accident or if you have some other ailment and you need an ICU bed, you're not going to get one. And I can tell you there are a lot of cases that you have not heard about, but they have occurred. A 40-something-year-old male who basically his sugar was too low. And normally a patient like that shouldn't die. Diabetic patients today live with diabetes. They should not be dying from it. This patient could not get an ICU bed to infuse him back with the insulin and the sugar that he needed because all the local ICU beds were full of COVID patients. The only place they could find an ICU that didn't have a COVID patient to make sure he didn't get infected was 4 hours away, and he died in transit. That's an unnecessary death because COVID-19 patients are taking up the ICU beds because that's how serious the disease is. Healthcare workers, they're a precious few right now. They are burnt out. They are suffering from compassion fatigue because they have been pulling off very long hours and working so hard to save lives under tons of heavy clothes, protective clothing, masks. It's heavy, it's hot, it's difficult for them. One of the groups of healthcare workers that we are having a shortage of are respiratory technicians. And that's very alarming because COVID-19 attacks your lungs. And we don't have respiratory technicians. We don't have enough of them. That means, if you need to be intubated quickly to help you breathe, that's going to be a problem. My family, this is just prior to COVID, we lost a 25-year-old member of our family because there was a shortage of respiratory technicians and they didn't have anyone to intubate her in the ER. The hospitals and the public system, they're financially challenged. The average cost of 1 day stay in an ICU where you use the top of the line equipment and the top of the line medical professionals can be somewhere around $15,000 a day. It's not free, it's costing the system. And right now we don't have to pay for it. But what if things flipped and the government decided to say, well, you know, people who don't want to get vaccinated, you're going to have to pay for your hospital stay because we can't just keep giving it for free. We don't have the money anymore. The other thing is we have a backlog of medical procedures because the ICUs and the healthcare workers are so focused on treating COVID patients. People who need cancer treatments, people who are waiting for hip or knee or other surgeries, who have other ailments, now have delayed appointments, some by years. And so their situations have been worsening and some have actually died because of the long delays. So there's these other effects of too many patients with COVID-19, you know, requiring the resources in our hospitals. There's some other basic things like accompanying your loved ones is limited. If you don't have your vaccine and you can't, you're not protected from the virus, you are putting your loved ones at risk. So if they're hospitalized, you may not be able to see them. And many of the early deaths of our elderly, their families couldn't see their loved ones during those last days. Vaccine passports are coming out, and those will also mean if you don't have your vaccine, you may be limited access to not just seeing your loved ones, but to having wonderful times and accessing things and services that you need. And just think for a second, if the vaccines were no longer free, and my earlier slide, you saw, for example, the Pfizer one is about $20 for the vaccine. That's just for the vaccine, but it doesn't have in there the cost of the nurse or the medical professional who has to give it to you, the administrative technicians and so on who have to organize your appointment to get it, the vial that the needle that's going to be used to inject you, the sterilization procedure and alcohol that's used to sterilize your arm. When you add those things in, the cost of that vaccine goes up. Right now, it is free to everybody, and we should be taking advantage of it, especially those of us who are from ethno-cultural and marginalized groups where we've been left out before. Here we get a chance to have equitable access, get the vaccine, and stay safe. Next slide, please. COVID-19 is still evolving. Yes, the information is changing, and that makes a lot of people very dubious about what's happening. But it is a smart it's a smart virus, and it is learning, but we can outsmart it. One of the ways to outsmart it and to get ahead of it is to get ourselves vaccinated. That way we protect ourselves, but we also protect our loved ones, and we can protect our community. Next slide, please. Oh, that was my last thing. So thank you. I hope that you through my speed presentation understand that I'm really just encouraging you to take the measures. It is your choice to protect yourself and protect your loved ones. As I said, the virus doesn't ask your consent when it invades your body, but at least with the vaccine, you've been provided a lot of information that allows you to make an informed consent and a decision about whether you choose to protect yourself and how. Thank you. If you have any questions, here.
Thank you, Sita, for such a compelling presentation. That was great. Thank you so much. I know we're a little bit past 9 p.m., but if there's any questions or comments, and yeah, please feel free to ask them in the chat or anyone.
Can I ask a question? I'm sorry.
Yes.
Okay, I want to ask, it's a general question. I want to thank you very much. This is really, really informative and a wonderful presentation from all sides. I just want to know, given everything that we said, and given that we are going to have those who will not be vaccinated for different reasons, personal and legitimate and non-legitimate, will just wearing a mask be enough? Because I know that we're having a problem with getting enough help in long-term care facilities. I'm dealing with, I have people who are working with elders, and I felt very strongly that they should be vaccinated. But I also there's no way that I'm going to get to change their minds. Well, and they say to me, wearing a mask is enough, because they also want to protect elders, but they feel that wearing a mask is enough. Can you tell me if that will be enough for those who will not be vaccinated? Doctor Larry, I'm asking this to
Well, wearing a mask will help, but it's not enough. Even if you are vaccinated, it's still good to wear a mask when you are going into crowded places, because you could still get infected. And even though you may not have symptoms, you could pass on to somebody else. So wearing a mask is still a good thing, but it's not enough.
Okay, thank you.
Yeah, and if I could just add, as again, someone who has to be around patients all the time and has a strong advocacy role for well-being of all patients, the mask is not enough. It is something, and it is great to wear it, but you know, it's covering your mouth and your nose and everything, but you're going to be still touching surfaces, and people will touch you, and you'll be around where droplets of COVID are flying through the air that you could make contact with. And so, as I pointed out in that slide, there are areas where that virus will live for up to 28 days. In some way, somehow you can touch it and get it on yourself. So it's still not enough. As well-intentioned as people are, I think the virus is just too sneaky and too easily able to be contacted. So think about choosing to be vaccinated to give yourself an advantage over it if it does enter your body without your consent.
You know, if I can, thank you, Sita, and thank you to all our presenters today. Great information, again, that was shared with the public. And I think, getting more and more closer to the idea of what's really happening in many communities, and more specifically within the Black community. And I think this is where continuing the conversation, like Laverne said, I mean, when we were at the first town hall, she didn't have the opportunity to, she wasn't vaccinated, but there was a reason for her. And by the second town hall, this is something that's become a part of her reality, but still questioning, and you're still here, Laverne, and we really appreciate that, that you're, sharing that personal journey that you have with so many people and so many of us, and also to our presenters to talk about their lived experience, whether they're epidemiologists or, in the behavioral lab, or with Sita in the hospital, and with Michael, with the folks in Youth in Motion and the community around Youth in Motion. We talk about the realities, but I think this is the important part, that we're definitely talking about the realities, and we're moving forward to other understandings, greater understandings, understanding that vaccine hesitancy is not limited to just a no, but there's a maybe in there, and how to get to those maybes, as well as Dr. Kessner so clearly pointed out, that it's really through conversation, it's really through getting to, the facts, that, decisions can be made, and we can take those steps along. You're right, Sita, the virus changes. It's very, very smart, and it's evolving as we go along, but continuing the conversations and continuing to encourage each other to be informed is, I think, the other win, in this pandemic that we're living through. So with that, I want to say thank you to everyone for being here. Thank you to Sophia and Omar for leading this project, and to everyone else behind the scenes. There's Dr. Kwasi, there's Dr. Farhad Desiree, who are here, and for getting this information out in your networks. We will be hosting a third session in November, and we hope also that you will be able to attend and to be a part of that, and that we still continue the conversations, and to hear each other's stories, and to see what has evolved at that time. So thank you so much, everyone. I really appreciate your presence and your engagement.
Thank you.
Thanks for coming, everyone.
you.
Yeah.
Thank
Bye
you.
bye, everyone.
Thank you.
Bye.
Thanks. Good night, everyone.
Yeah.
Okay, thank you. Yeah.
Thank you very
Right.
much.
Bye bye.
Thank you.